Thank you for having me. I was very honored to be asked to come and join in your sessions. Looking over the panelists and the sessions that you've had so far and ongoing, I'm kind of humbled to be following Admiral Ricks. For sure, and many of the other panelists. So you're getting the full scope of great information on a super program. I've gotten a chance to I know there's a number of you out there who I've gotten a chance to work with either on an employment basis or or working together as colleagues. And a little bit of background about myself before I get into. I'm going to try to cram about an hour and a half presentation into about 15 minutes. So it's going to be maybe a little bit frenetic as we go. And I want to be able to help with answering some questions at the end as well, since this is, for some of you, I guess, is foreign territory. Again, a little bit of background about myself. I've been lobbying in the healthcare space in Harrisburg for about 35 years now. Started with the Optometric Association. And in 1999, I came to work with Wannett Associates. We're an association management firm. We do lobbying and association management for a number of groups. And my niche has been largely healthcare organizations. I still work with the optometrists on contract, and we also work with audiologists and acupuncturists and medical suppliers. Haven't worked directly with any dental groups yet, but I've been able to work with them in a lot of different coalitions that I've been part of. Obviously, optometry and dentistry and podiatry work on the diabetes access issues and things like that. I've been very honored to work with Lisa on rural health things for a number of years now. And so, I have a little bit of understanding of where you all are coming from and the challenges that you have. What Admiral Ricks was talking about with the salaries and student debt and all that kind of stuff is across the board with all practitioners coming out of school and trying to get access to health care in an age where everything's going to managed care and trying to get people to practice in certain locations has been a big problem in many fields. So my clients tend to, as we say, kind of treat the body one body part at a time, as opposed to but we try to educate the legislature and policymakers on a number of different issues with regard to health care, so that they understand that it's not just physicians and hospitals that are providing the health care. In fact, about 80% of health care is not provided by hospitals and doctors right now. So, what you folks do is a key part of health care. I was talking at breakfast with a couple of folks, and it was amazing to me when I first started with optometry that for some reason vision and dental was kept separate from the rest of the body health insurance plans, and I'm still not exactly clear on why that remains the case. As it should be clear to everybody by now that those two body functions are definitely part of the whole health of the rest of the body. So, but that's a conversation for another time, I guess. Anyway, all that leads. Some of us use the term lobbying, and I think in the nonprofit world, and a lot of folks would prefer the term advocacy, and it's all kind of the same thing. And the point of my presentation is that the getting involved in the legislative process, bills, how a bill really becomes a law. Everyone's seen the Schoolhouse Rock presentation of how a bill becomes a law, and I'll spare you my rendition of that. But there's a bill is introduced, but long before a bill is introduced, there's an idea that comes from somebody. Legislators largely don't come up with these ideas themselves. Someone brings them to them. I know that there are some legislators that I call 60 Minutes legislators who watch that program on Sunday afternoon and or Sunday evening, and on Monday they introduce a bill to make sure that thing will never happen in Pennsylvania, and it probably won't, but that it gets a headline and a news a little bit of news for them, and then it goes through the very vast legislative process. In a legislative 2-year 2-year legislative session in Pennsylvania, there's between 4,000 and 5,000 bills introduced. Maybe about 200 of them will ever get to the governor, and many of them are spending bills. All the rest of the bills have to go through an intense scrutiny process that requires people, legislators, to study all these issues. And legislators come from a variety of different backgrounds. Some are farmers, some are lawyers, some are all kinds of educators. Some are healthcare providers. Not nearly enough, I will tell you, are to help with making some decisions that make sense for the general populace. But so it comes down to the people who are experts in the fields to talk to their legislators and their local health administrators to make policies that make sense. People are now doing their own research in a lot of fields, and but you folks are the ones who are really expert in what you do, and your job, and if there's an issue that's coming up, either whether you're initiating it or whether someone else has initiated it, and you might not agree with exactly how that's being presented, is to go and talk to them. There's a number of ways you can contact. When I first started doing this program back in the late 80s, early 90s, there was really basically 3 ways that you would contact legislators. It's a personal visit, a telephone call, or writing them a letter. All of those are still available and probably still among the more effective methods of convincing a legislator. But it's all about relationship building. You're trying to establish yourself as the local expert on a field. So when a legislator has to vote on a bill, again, there's 4,000 bills. When they come up, when these bills come up in committee, and somebody who has been a farmer all their life needs to talk about a dental issue or an oral care issue in any regard, they have no idea what they're talking about, and so they need to be able to go to somebody, have somebody on their speed dial that they call and say, what do you think about this bill, before I vote on it? And so there's many ways to do that. Again, those 3 issues. In the 90s, we had this magic new toy called the fax machine, which of course nobody uses anymore, generally doesn't use anymore, particularly as we've gone to electronic health records and all that too. And then social media, and this past year and a half, I guess, we've been able to use Zoom as well. So that's Zoom is very often used now for legislative contacts. The legislators, it's easier to schedule a meeting when you either don't have to go into their office or they don't have to come to your office. You can schedule a meeting with your legislator and as a Zoom meeting, and you can get a couple of other people from different places in the one spot pretty easy, and that works out pretty well. I'm kind of an old guard lobbyist. I still like to do things in person when I can, but I have made a lot of good use of Zooms just because of the time saving. Sending an email is kind of the fast and more mindless way of doing things, and there's a lot of corporations or companies out there that have tools that you can use to click and send a piece of email. Legislators get hundreds of thousands of emails, and there's a lot of ways for them. A lot of them go to junk. A lot of them get read by somebody else other than the legislator. So it's much easier, it's much more effective to try to at least make some type of personal contact with the legislator and build that relationship. I won't go through the whole legislative process, but there's just some keys I wanted to leave you with. I know I'm running on time here. When you're talking to a legislator, first of all, don't be afraid of them. You deal with people in your own practice settings, all the time. Talk to them as you would any patient that you have. More like you would talk to an 8-year-old than some of the other adults a lot of times. But I say that facetiously, not entirely facetiously, because you have to go in understanding that they don't understand. I always try to tell my clients and people that I am coaching on talking to legislators, never start a sentence with, as you know. That's not a valid assumption most of the time, and it also can create a little bit of awkward situation for the legislator, because maybe they are supposed to know that, and then now they can all think about, wait, do I know this? And they don't know, and they can't keep all the stuff in their head anyway. So that's not the atmosphere you want to do. You want to have an educational process, and you can say, stop me if you've heard this, but it's always, for me as a lobbyist, it's better for me to go in and talk to a legislator when somebody back home from the organization that I'm representing has already talked to them, and I can say, Dr. So-and-so, or was in to see about this, and then we can get to another level. But when you're having your first meeting with a legislator that you don't know, and you should try to do a little bit of research on the legislator, and it's easier now with social media and everything else out there. You can find out about the things that are interesting to them. Try to blend a little bit of conversation and common ground building with the legislator on things outside of what you're talking about. But then when you get in there, your organization probably is sending you out to talk about a particular piece of legislation or an issue, and they have developed some talking points. It's taken the staff and your leaders a while to develop the strong one-page talking points. Try to stick to those. I always caution my client groups to not try to negotiate a bill in the office with a legislator when we've already got the bill the way it is. Not everybody agrees, and the bill's not going to end up, most likely is not going to end up that way, the way it is initially introduced before you get it there. But depending on where you are in the process, where the bill is in the process when you get there, you can talk about, and hopefully your organization will let you know where we are in the process and what's been negotiated, and also try to go in armed with knowing what the other sides or other potential views are out there. Legislators, and again, when it's your first time talking to somebody, it's okay to get something other than yes, I support your bill. It's good to know. It's good to know for us lobbyists who have to count. Remember, you're not going to get everybody on any issue. You need one more than half in the House, and you need one more than half in the Senate, and you need the governor. So it's for vote counting parts. You need to report back to your lobbyists or to your association on what you heard, because the rule that we follow is everything but yes is no. That sounds like a good idea is not a yes, or I understand, or I see that, or if you hear, well, I'm gonna have to talk to the committee chair. I'll have to go back and take another look at this. That's pretty much a no. But that's okay. We just need to count, and you can go back and follow up on things. Another key in any type of correspondence is never make anything up. If you're asked a question, and it's perfectly fine to say, I don't know, but I will get back to you. And that provides you a second opportunity to contact that legislator. Follow-up is important anyway, thanking them. Legislators, believe it or not, rarely get thanked for even spending 15 minutes with folks. They think, a lot of folks go in there and they demand something, they go and they leave, and then and the legislator just moves on with their day. But if you follow up and build that relationship and see them, particularly state house members, you'll see them at church or in the grocery store or somewhere else on the street or in the local club. Just sit down and say thank you, and say hello, and develop your relationship wherever you can. You can get involved if you're so inclined. Get involved with their their political races, their races for re-election, and if you can, in some fashion, or just endorse them in any way that you can. Remember that you have access not only to your own vote, to tons of people that you serve who are also constituents of the legislator. So they listen to you, and just take advantage of that. But don't go in with the attitude that you owe me because you work for me. They work for a lot of people. So, and they're not going to agree with everybody. So, try to be agreeable and get out there and just do it. the dread of it is usually much worse than the actual doing of it, I can tell you, so.